to us Ms. Elizabeth Fisher and Professor Lorraine Conroy of the Environmental and Occupational Health Series. They both are with UIC Center for Healthy Work, and we're really looking forward to their presentation to us as it relates to essential workers. My name is Charlotte Kabori, and I'm a DRPH Cohort 2019 presenter to moderate with you tonight. And what I will ask for you to do is, if you have any questions for the presenters, please place them in the chat section. And what I'll do is at their Q&A section during their presentation is to share with them any comments or feedback that you may have for them. So we're really looking forward, and at this time, I will pause and turn it over to our presenters. Thank you.
Thank you. I'm Lorraine Conroy, and I'm going to start, and Liz will take over in the middle and then finish at the end. So just a short outline of what we're going to talk about. I'm going to talk a little bit about work and health, and then shelter-in-place orders. Liz is going to describe the state shelter-in-place order and how that impacted work. And then I'm going to talk about essential work and the impact of COVID on work, and then a little bit about the hierarchy of controls and how we think about addressing issues like this in the workplace. And then Liz is going to talk a little bit more about some of the guidance that's come out from the state. So I wanted to just back up a little bit. I know this is a very diverse group of students, and think about why occupational health is important. So one of the reasons, and probably the most important, is that workers are people, and we often get sort of bogged down in statistics and don't think about what's behind those. But Irving Selikoff is quoted as saying that statistics are human beings with the tears wiped away. And I just wanted to just remind that's part of the main reason why I'm in this, is that when workers get injured, those can have a devastating effect on them and on their families. And that also fatalities, which is what we measure probably the best, is really just the tip of the iceberg. For every worker that gets killed at work, there are thousands of workers that get injured. So it is a big problem. We've had a big improvement over the last 100 years, but we still have a ways to go. The second reason is cost, and that these are the most recent cost data that I could find. They're from 2007, so they're a little old. But at that time, we estimated that the cost of workplace injuries and illnesses was close to $250 billion. And of that 250, 67 billion alone was for just medical costs associated with injuries and illnesses. The rest was indirect costs, which would have been things like replacement wages, rehiring new workers, long-term disability, higher insurance premiums, lots of other things. But this 250 billion is very close to the cost of cancer in our society. So while cancer gets a lot of play and a lot of attention, we don't really pay as much attention to occupational injuries and illnesses. The other cost that should be of concern to people is that there is a workers' comp system, but only about 25% of the costs get actually covered by workers' comp, and the rest is shared by society, either through private health insurance and therefore shifting it onto increasing everybody's premium, or onto public systems like Medicaid or Social Security. Another reason to care about this is that risks are not randomly or equally shared in our society. So there are power dynamics that influence working conditions. There's a disproportionate impact on workers with limited power. And organized workers generally can take more action, but there's still a power dynamic, and it's difficult to affect change. In our history, we've usually only taken action after a tragedy. And in many cases, the people who know about the hazard and could do something about it don't disclose that information. So often workers don't even know that they're at risk. There have been improvements in both how much workers have a right to know about and in improving conditions through worker advocates, usually led by workers with support from others. Another reason to think about work and health is that we think about work as a determinant of health, but I don't know if you guys have read the Lincoln Phelan paper on fundamental causes, but work really influences all of the societal hierarchies that determine these fundamental causes of health. So things like power, money, prestige, social connectedness, and the nature and the type of work you do has a direct bearing on whether you have access to these fundamental causes of health or whether you lack them. If we think about just the social determinants of where we live, work, play, pray, age, all of that, your work determines how much money you have. So it determines your access to safe neighborhoods, what kind of housing you live in, what kind of transportation you have access to, things like that. It also influences not just what you can buy, good foods or, better housing, but it also influences how much time you have. So people that have lower incomes or less wages or less stability with their work have less time for rest, relaxation, family, exercise, all of those things. And then the work itself can be hazardous or dangerous. So there's a variety of different types of hazards that people are exposed to at work. So what is healthy work? We're the Center for Healthy Work. So this is a figure from one of the papers that we've produced from our center, where we asked workers, residents in a community, how work impacts their health, either good or bad. And they described a lot of different ways that work influences their health in a negative way, but they also described a number of ways that work provides for positive, their healthy aspects of work. And we don't often measure these things, but things like having a space to get away from other life stressors, getting social support from people at work, having a sense of self-worth and pride and reaching personal goals. Just some types of work can actually be a form of exercise, so it can lead to better physical health. And then at the center, we've defined healthy work as work that's free from workplace hazards, that pays a thrivable wage, that offer job security, provide benefits, and that's work that's free from discrimination and exploitation, that offers opportunities for advancement, and also provides freedom and protection to express concerns, organize, and participate in workplace decisions. By contrast, we spend a lot of time actually looking at precarious employment. It's probably more common than what I just described as healthy work. It's characterized as insecure, unstable, uncertain work where you don't know if you're going to work tomorrow. It lacks flexibility, so you don't know what your schedule is going to be and you can't take time off. You don't have control over hours or schedules. In many cases, there are limited benefits like health insurance or retirement, little opportunity for advancement, wages leading to economic uncertainty. And then many of these jobs that have these sort of organizational factors are also the jobs that have exposures to the highest hazardous and most dangerous conditions. There are a lot of reasons that precarious jobs have negative health impacts. Lack of job training can impact safety. Precarious jobs are, people in with precarious jobs are more likely to experience discrimination. Most workers rely on one or more social safety nets or one or more jobs to actually make ends meet. It leaves little time or pay for education or childcare. And the characteristics of this, again, are not random. Precariously employed workers are more likely to be minority or foreign-born workers. They're more likely to have lower levels of education, have higher levels of stress, and work in dangerous conditions. This level of precariousness in our workforce has increased over time. There are some industries that have always had high levels of precarious or alternative work arrangements. It doesn't share all of the characteristics, but you don't have necessarily constant work, and often you're self-employed. So in industries like construction or professional business or some other services, we've had high levels of that all along. But what we've seen over the last couple of decades is an increase across the board in the number of part-time, temporary, contingent work in all sectors of our economy. And these things that I'm pointing to now are industries that also have higher than average injury or illness rates. So they coincide in many cases with the industries that have the highest level of alternative work arrangements, non-standard work. So again, construction, manufacturing, transportation. This is a chart of fatalities, and the large majority of fatalities occur among wage and salary workers, but that's also where most workers work, as wage and salary as opposed to self-employed. And the rate has actually ticked up among wage and hourly workers over the last several years. But it's worth noting that while the numbers are lower for self-employed, the rate of fatalities among self-employed workers is about 4 times that of wage and salary workers. So being self-employed gives you some benefits, but there also puts you at greater risk for a number of things. And then people that are worried about becoming unemployed are more likely to report fair or fair health. They're more likely to be obese, sleep less than 6 hours a day, smoke every day. High levels of workplace stress leads to higher rates of cardiovascular disease, mental health disorders, musculoskeletal disorders, and then higher rates of coping mechanisms or poor health behaviors. And then several industries are also at greater risk for wage theft. So even though they may be making minimum wage, they actually don't get to keep all of that. And wage theft is fairly common in food and drink services, retail work, and education and health work, although I'm not really quite sure why. I think that's more on like being a nanny or a home care worker. And so this is just to set you up to what work looks like and what the risks that workers faced before COVID and continuing through COVID. But now Liz is going to talk about the governor's executive order and what happened in Illinois. And you'll have to tell me to advance the slides.
Yeah, I was just about to say, I don't think I can advance the slides. So this is perfect place to start. I think everyone should have read Executive Order number 8 prior to class, but we just want to spend a little bit of time reviewing it and then talking about what it means when it refers to essential business or minimum operations. So to provide a little bit of context, Executive Order number 8 was really necessary to ensure that our healthcare delivery system was capable of serving those who are sick. This is something we hear about a lot. However, there was less attention paid to the fact that COVID-19 resulted in significant economic impact, which is why there was a need to make sure that we are addressing housing security and stability and ensuring that eviction orders on residential premises are contrary to the interest of preserving public health. So we'll get into a little bit more of that as we go on, but this is just a context about this executive order. Next slide.
Oh, that's me, sorry.
It's okay. So there are 4 main things that are covered in this executive order. The first is that residents are ordered to stay at home. This is what we talk about a lot. There are exceptions for essential travel and essential work, or to obtain supplies, get exercise and recreation outdoors. The executive order also defines essential businesses, operations, and government functions that are exempt from the order. And it reduces allowable public and private gathering size to no more than 10 people. I think it was Executive Order 5 that had come out previously that allowed 50 people to gather, and then Executive Order number 8 superseded that. Orders of all law enforcement officers also to cease enforcing eviction orders for residential premises. So that's what we were talking about just a second ago with housing insecurity being a public health issue. Next slide. So the first one I'll go over is the stay-at-home order. This is something that I think we should all be familiar with at this point. It ordered people to stay at home or their place of residence, to keep 6 feet of distance when using shared outdoor spaces. The order does explicitly call out individuals who are experiencing homelessness and that they are exempt from this order. It also acknowledges that some people might be experiencing unsafe housing due to domestic violence or other personal issues, and they are allowed to seek alternative housing during the stay-at-home order. Travel also is prohibited unless essential. One thing I want to call out here is that Executive Order 8 did allow people to leave the house for essential supplies, which gets into our conversation about who is working at these essential businesses. Next slide. So the executive order defines essential businesses, operations, and government functions. And so all businesses were required to cease activities except for minimum basic operations. Employees were encouraged to work from home. And essential businesses and operations were defined and encouraged to stay open with social distancing requirements. Next slide. So now we're going to define what minimum basic operations are and what essential businesses and operations are. Next. Yep, thanks. So minimum basic operations refer to the minimum necessary activities to maintain the value of the business's inventory, also to preserve the condition of the business's physical space and equipment, and ensure security, and process payroll and employee benefits. The minimum necessary activities to facilitate employees of their business to be able to continue working from home. So this does include making adjustments to the work processes so that as many employees as possible can work from home. Next slide. So when it talks about essential businesses and operations, it's important to think about who is working in these jobs and what this really means. So these first 4 sectors called out in blue sit outside of the essential businesses section in the order, but I wanted to call them out as important because they really explicitly are called out because residents may leave their home to work or access services from these sectors. So this is what I had referred to previously, where government functions that are excluded from essential business and operations, but still must maintain operations. Other sectors that were included in essential business and operations were stores that sell groceries and medicine, food, beverage, and cannabis production, and agriculture, organizations that provide charitable social services, and more. But before I go on to the more, I really want to call out one of these specifically. So let's talk about food, beverage, and cannabis production and agriculture. The executive order goes on to define what that means, and I'm gonna read out to you that definition. So this includes anyone who works in food and beverage manufacturing, production, processing, and cultivation, including farming, livestock, fishing, baking, and other production agriculture, including cultivation, marketing, production, and distribution of animals and goods for consumption, licensed medical and adult use cannabis dispensaries, and licensed cannabis cultivation centers, and businesses that provide food, shelter, and other necessities of life for animals, including animal shelters, rescues, shelters, kennels, and adoption facilities. So if you look, this becomes a really massive list when you look at the granular level of what each of these sectors really is. And if we go to the next slide, we'll see that the list goes on and on. So it includes everything from media and transportation services, financial institutions, supplies for essential businesses and operations, residential facilities and shelters, hotels and motels, funeral services. So ultimately, some of us have this perception that most people are working from home. But when we look at all of these sectors that are included as essential businesses and think about how much falls within these essential businesses and that each of these businesses operate differently, it really becomes this massive amount of people who are continuing to work. Next slide. So, just to go on with the executive order before we talk about who's most impacted by this order. Another key point is that it reduces allowable public gatherings to no more than 10 people. All places of public amusement, whether indoors or outdoors, are closed to the public. So if you imagine, all places of public amusement is again, this very large category when you look at it at a granular level. And if these places are closed, we have to think about how many people might now have insecure incomes or be unemployed as a result. This order, as I mentioned before, also supersedes a previous order that prohibited gatherings of 50 or more people. So as you saw, as we learned more about the pandemic, we saw that decreasing the amount of people that could gather was a necessity. Next slide. So last but not least, COVID-19, or Executive Order number 8, ordered all law enforcement officers to cease enforcing eviction orders for residential premises. But, I wanted to include this quote from the executive order because I think it presents a really important dichotomy where evictions are not being enforced. However, the executive order explicitly states that no provision shall be construed as relieving any individual of the obligation to pay rent, to make mortgage payments, or to comply with any other obligation that an individual may have under tenancy or mortgage. So again, there's this acknowledgement that people's incomes have been disrupted. There is increased income insecurity. We will not be enforcing evictions as a result because of the public health threat. However, you are still required to pay your rent and your mortgage. Next slide.
Okay, so I've sort of organized this just as a visual based on what Liz just described. So, this governor's order and that sort of the first cut sort of split people into people that could work from home, whether they have essential work or not, and then people that couldn't work from home. And then the second cut was for those people that couldn't work from home, whether they had essential work or non-essential work. And then I've also sort of split the essential work into healthcare and first responders and then other essential work. And it'll be more clear as we move through. But I want to talk about who are these people in each of these groups and what does it mean for them. So the groups that could work from home were, occupations like management, business, and financial operations, where 60% of those people were thought to be able to work from home. Professional and related businesses, sales and related operations, and then office and administrative support. The businesses or occupations that were least likely to be able to work from home were occupations like construction and extraction, installation, maintenance and repair, production, which is manufacturing, and then transportation and material moving. So just by the nature of work, it became clear who could work from home and who couldn't. Education was another factor that played into this. So people that had a bachelor's degree, about 50% or more of those people had occupations that allowed them to work from home. And people with less than a high school diploma, only about 4% of them had jobs that would allow them to work from home. By race and ethnicity, non-Hispanic whites were much more likely to be able to work at home. About 30% of all non-Hispanic whites could work from home, whereas only about 20% of Black workers and only about 16% of Hispanic workers have jobs that could be done from home. Age was a little bit of a funny thing. I didn't include it on here. Really young workers, so 15 to 24-year-olds, very few of them had jobs that could be done from home, but nearly everybody else had similar rates, which was about 1/3 of all workers by age could work from home. But full-time and part-time work had a big difference. So about 33% of all full-time workers had jobs that might allow them to work from home, and as opposed to only about 14% of part-time workers. And then earnings was also one of the predictors about whether you could work from home. So workers that had high income, so they were in the highest income quartile, the 75th to 100th percentile of earnings, about 62% of those workers had jobs that could be done from home, whereas only about 9% of workers in the bottom 25% could do jobs from home. And then workers that had flexible work schedules, about 42 before the pandemic, so their work was kind of flexible already, about 42% of them were able to work from home, compared to only about 12% of people that had inflexible work. In terms of essential work, so these are people that had to go to work or couldn't work from home and were essential workers. We see that Black workers are overrepresented in many of these. So I'm listing here all of the job occupations where Black workers make up more than 20% of the workforce. And you'll look, if we scan through the list, you'll see that many of these jobs fall into this couldn't work from home, but is essential work. As a reference point, Black workers make up about 12% of the US workforce, but they make up 45% of nursing assistants, more than 40% of security guards, home health workers, and more than 20% of this other list. And there's more of it didn't even, there are six other jobs that didn't fit on this list, that include things like taxi drivers, housekeeping cleaners, janitors, and building cleaners. In terms of risk for essential workers, there's a high correlation between, one study found a high correlation between occupation and COVID deaths. And they found this correlation was highest among protective service workers, healthcare support workers, transportation and material moving, and office and administrative support. And the lowest correlation with farming, fishing, forestry, and then sort of professional science and other occupations. A Canadian study found that women were overrepresented in high-risk jobs such as healthcare, and that older workers had jobs that allowed for more physical proximity, but about the same frequency of exposure, and that low-income workers were really the ones that had the greatest risk of exposure. I've had a really hard time finding data by occupation that in the US or worldwide, actually. It's just, we're not collecting data in a way that's tying this to work. But there were two studies that came out, two reports that came out recently. One is a ProPublica report that came out in September, where they documented that more than 9,600 postal workers have tested positive. And again, postal workers would fall into this essential government operations. And that at least 83 of them have died, and that in meat processing, which we have seen in the news, the CDC reported on the 28 states that were reporting data in July that there were more than 17,000 cases and 91 deaths. This is another study that was sort of interesting. It was a little hard to follow, but it was interesting to show, again, sort of this racial difference of exposure and risks at work. And so what they did was they took a lot of different occupations, and they described them as either likely exposure, frequent exposure to infection. So there were jobs that are described as having frequent exposure, or people responded to surveys. They were employed in occupations with frequent close proximity to others. And then they combined some of that together where people had both employed in occupations with frequent exposure to infections and close proximity. And what they found was that African Americans, Asians, and Hispanics were overrepresented in all of these industries where people would be at risk. So they either are likely exposed and it is an essential industry, they're likely exposed and it might be an essential industry. And again, depending on the state and how you interpret these executive orders, it's a little hard to tell sometimes what's an essential industry and what's not. As well as in occupations with frequent exposure to infection, frequent close proximity to others, and frequent exposure to infections and proximity to others. So again, as a reference point, whites make up about 78% of the workforce, Blacks make up about 12%, Asians make up about 6%, and Hispanics or Latinos make up about 17%. It doesn't add up to 100% because we categorize Black or Asian as white as races and Hispanic as ethnicity. And so there is some overlap between Hispanics and some of the race categories. But you can see again that the risk of, or the jobs that have high levels of risk are disproportionately done by Black, Asian, and Hispanic workers. And then there's the non-essential work. So these are people that can't work from home, but they are non-essential work. So they couldn't go to work either. So many of these people became unemployed. And we provided benefits in a series of packages, both at the state and federal level. And for the first time I can think of, they expanded the unemployment insurance to cover people that normally wouldn't have been covered. So, in general, prior to this emergency, if you in order to collect unemployment insurance, you had to have an employer who was paying into the unemployment insurance pool, and then you were eligible for unemployment insurance. That got expanded with a lot of federal supplements to that, to people that were working, but they had to still prove that they had been employed. So they had to have some kind of record of being employed and being able to show what their level of income was from that employment to be eligible. And then we've heard, particularly in Illinois, a lot of issues with procedural barriers, just accessing what you were, eligible for, but just getting that. But, unemployment also carries a whole package of health risks that are similar to or overlapping to those that I described for precarious employment, just more extreme. And so the biggest impact from a non-COVID point of view of the epidemic has been probably on these non-essential workers that are not eligible for benefits. And these include undocumented workers or other workers that have barriers to formal work. And there can be a lot of different barriers to informal work. Prior incarceration makes it hard to get a job. And so people that don't have formal work often engage in informal work, street vending, bartering for necessities with neighbors or friends or others in their network. And most of that also got disrupted by the pandemic. So I've tried to think about how to sort of conceptualize this in terms of overall risk and protections for workers. So I think, this is my first stab at this, and I'd like to maybe use some of our discussion time to think about this. But, there's this group of workers that could work from home who then had limited COVID risk unless they imposed it on themselves through their social life, but their work didn't present them with a COVID risk. And because they continued to work, they really didn't have an increased or any kind of economic disruption. And they didn't really need any specific workplace protections for preventing COVID risk. And then in the essential work, I've divided them again into these healthcare workers who I think had high COVID risks, right? They were in close proximity to people that were known to have the disease. But they didn't necessarily share economic disruption in the same way. But they probably, and probably even higher than I've marked here, had a social disruption. So many of them chose not to go home because they had been exposed to high levels of, they had exposure at work, or they were positive and they didn't want to bring that home. There was, they were working crazy hours, and but we also directed a lot of the protection to that particular workforce. And then there's this other group of essential workers who also had pretty high COVID risks, not because of the known patient, taking care of patient, but because they were in spaces where they had close proximity to other people, and were not able to protect themselves. So they didn't get quite the level of protection. It was slow to come. Employers are catching up now, but it really was a long time coming before they were provided protection. Many of them also had similar to all of us that are suffering some social disruption. But they also, I think, had economic disruption. So while they might have still been working, in many cases their hours were cut, or their jobs became somewhat unstable. We'll call you if we need you kind of jobs. And then the people that had non-essential work and couldn't work from home had very large risks of economic disruption and continued, like everybody else, social disruption. But I've marked them as being, I meant to put question marks in here on COVID. People that had benefits probably didn't have as high a COVID risk from work, but people that can't work in the formal sector and don't have any benefits are likely to continue to work. They're just going to find a way to get income. And I think some of those ways that they may hustle to get, money, put them at increased risk of COVID. So that's a sort of complicated explanation, but it's how I've been thinking about this work-relatedness of risk. I'm going to talk for just a couple of minutes about the hierarchy of controls, and then Liz is going to talk about some of the reopening guidance. But in occupational health, we have this hierarchy of controls where the highest level of protection and the most effective controls are at the top, where we eliminate the hazard, or we substitute, or we engineer it in some way to isolate people from the hazard. And the least effective is with personal protective equipment. But I've included this other picture because it's really hard when the source is a person to really follow this hierarchy of controls. So I've been trying to think and make recommendations based on source, air path, and receiver locations. So examples, and the picture doesn't match COVID, but if you think about a person with an infectious, it's positive and putting out infectious particles as the source, there are a number of source controls that we can use.
Yeah.
So in healthcare, hello? Oh. In healthcare facilities, they isolate them in isolation rooms where they have negative pressure and the people outside are somewhat protected from that. We increase the ventilation rates to dilute the contaminant, and then healthcare workers wear N95 respirators. So there's a level of protection at the worker as well. In terms of the general public health guidance, the source control, again, have been wearing masks, cloth masks as a source control, so that if I'm unknown to have disease, but I do, and I'm talking or in a space with other people, I'm minimizing at least as much as I can the amount of particles that I'm putting out. We've, being outside is a pathway control. You have higher levels of dilution, less likely to transmit to someone that's near you. Having increased ventilation rates in, common spaces. And then the 6 feet of distancing is another pathway control. We're really trying to interrupt the source to receiver path by being far away. And then the receiver controls at the outside of the healthcare facility have been harder to come by, and quite honestly. But I think, things like hand washing are a receiver control, although we're now, the current thinking is that that's not the primary way people are getting exposed. But I think also, the masks that we're wearing might provide some benefit. They're more likely to be effective as source controls. And then when we get a vaccine, that will be both a source control and a receiver control, where if I get the vaccine, I'm protected from somebody else that might have the disease. So it's a control at the worker or the person, but I'm also much less likely to transmit the disease. So it's also a source control. All right, so with that in mind, Liz is going to talk about reopening guidance, and I want you to think about whether these guidelines actually are sort of in line with these public health recommendations for controlling transmission of disease.
Great, thanks. So I am going to focus specifically on the guidance that came out from the Illinois State Department of Commerce and Economic Opportunity. This guidance was done in partnership with other state agencies, including the Illinois Department of Public Health. And while, if you were to quickly peruse the websites of different state agencies, you would find that many of them do have information about how to respond to COVID-19. However, DCEO did create the most comprehensive package of toolkits for businesses by sector. The guidance included everything from signage and posters to toolkits, social media posts. They're massive packages, checklists for both employers and workers. And they have been updating the guidelines based on the phases of Restore Illinois that we are moving through. So I'm sure you're all familiar that Illinois has, I believe it's a 5-phase Restore plan, and we are currently in phase 4, or revitalization. Next slide. So in phase 4, the sector-specific guidance for employers and workers covers this wide range of businesses. So retail, offices, manufacturing. I laugh at offices because that could be so much. And so many of them look so different. Health and fitness centers, service counters, outdoor and sporting events, zoos, indoor and outdoor dining, indoor and outdoor recreation, meetings, and social events. Next slide. And so here's a little peek at what it looks like on DCO's website. And once I'm done talking, I'll send a link in the chat because it is really interesting to go through. One thing to keep in mind as you're looking at it is the differences between sectors and how the information is presented to employers. As I mentioned, you see on the left, we have the guidelines for restaurant and bar establishments, and then on the right, we have a checklist. So, the idea is that this provides a checklist for employers to go through to make sure that they're following all of the recommendations put out by the state. Next slide. So, the Center for Healthy Work has spent a lot of time reviewing the reopening guidance put out by the state, which is why we're focusing on it today. I will talk at the end very briefly about the competing guidance that is out there because there is so much. But in the DCO guidance, there were some concerns raised about workers in Illinois not being adequately protected in this guidance. And partially that is because there was a focus on business owners making business safe for consumers rather than workers. And we know that, based on our conversation and the slides that were just presented, that while many workers and their families have been able to shelter at home, continue to work, maintain their income, and protect themselves and their families, a significant number of workers do not have the ability to do that. And many of those workers are already economically disadvantaged and are employed outside of the traditional safety net protections that we've talked about, and therefore were unprepared to manage COVID-19 related health impacts on themselves and their families. So more fundamentally, these workers were also less likely to have access to sources of health protection like PPE, which we just talked about, paid sick leave, and health insurance. Next slide. So the critique that I'm kind of going to do of this reopening guidance is going to focus on two sections: the process for developing and finalizing guidance, and then the appropriateness and enforcement of guidance. So we'll focus on the first one, the process for developing the guidance. As I mentioned, this was created by DCEO in partnership with a number of state agencies. You can go forward to the next slide.
Okay, sorry.
Thank you. You're fine. So, there were a number of things that upon review became really clear. So, I believe initially DCEO had claimed that they were reaching out to stakeholders across the state to ensure that there was adequate feedback in developing this guidance. And so some of our, either lessons learned from creating this guidance or things to pay attention to for future iterations of guidance are, ensuring that there's input from business representatives and worker advocacy organizations in the process. So some ways to do that would be to develop a task force of worker advocacy leaders, union leaders, workers, business organizations, small business, community organizations, governmental public health, to ensure that diverse voices are considered in the development of guidance. We would also expect to expand key contacts with worker advocacy organizations in southern, western, and northern regions of the state to make sure that guidance isn't Chicago-centric. That's frequently something that we see, that, Chicago is the biggest city in the state, that we need to make sure that attention is paid throughout the state, which is an incredibly diverse state. Another really important thing to pay attention to in input from workers and worker advocacy organizations is potentially including union representation at the table. So if there are established labor industry relationships, collective bargaining can play a really powerful role in ensuring that guidance is implemented in a sound and consistent manner, and really ensuring that there's worker buy-in in the process. Another thing that we haven't talked a lot about today, but you may have in your class previously, is contact tracing. And so contact tracers, because of their firsthand knowledge of how COVID-19 spreads and the conversations that they're having with people who have been infected, it's really vital to involve them or leadership in contact tracing and the development of guidance because of this firsthand knowledge. Another important thing that could be considered for guidance is a public comment period. So giving the public an opportunity to review the guidance and respond in a public comment period prior to future guidance being developed and finalized is a valuable way to make sure that there's input from workers and consumers. And then also evaluating the guidance. So does a structure exist to really monitor the effectiveness of the guidance? So how many complaints are being received from workers about the guidance not being followed by their employer, or the numbers and types of requests for assistance received by employers, or the size of the business that is requesting assistance? And ultimately, it's critical that workers and supervisors who will be responsible for the implementation and enforcement of reopening guidance and who are being placed at the greatest risk be consulted in the development of that guidance. We know that the public's health is safer and workers are safer when they're empowered to play a role in determining the conditions that they need to protect themselves and the public. Next slide. So here I'm going to focus on appropriateness and enforcement of the guidance, and this is really where a lot of the meat is. And it's important for us to talk about the enforcement of the guidance because, you know, we'll talk a little bit more about this when we get to the messaging and terminology, but without enforcement of the guidance, how do we know that employers are actually doing this and protecting their workers? So, you know, we know that the interests of business and public health can be at odds sometimes. And so local and state political action is necessary or can be necessary to determine incentives for business to prioritize health and safety over profit. There is some fear that employers and businesses are cherry picking what they follow in the guidance. And so there's significant concern that they're not complying and they're doing so with impunity, which is why enforcement is so important. Guidance should include strong and clear enforcement mechanisms. If you take a look on the website, you will see that the current guidance put out by the state does not include a significant amount of information about enforcement for workers to use. And so, you know, ideally, when we talk about enforcement, workers would have information about how to report violations, penalties for noncompliance, and employees and public can then hold employers accountable and businesses accountable. Another thing that when you all get a chance to take a look at the DCEO website, pay attention to the definitions of employer-employee. I think we briefly talked about today contract and temporary workers who might have an ambiguous relationship with their employer. So if someone doesn't have a clear employer of record, there's no real information about who's responsible for sharing the guidance with the worker and who's responsible for implementing the guidance. So it's really vital, again, to make sure that the language is clear and consistent so we know what employer is and we know what an employee is. Some other things that probably require further clarity in this guidance to really protect workers includes, you know, acknowledging what happens in multi-unit office buildings and shared space. That I think I had said that I laugh when I see offices on the list of guidance because offices look different. And we know, especially in a city like Chicago, but also across the state, that there are buildings with multiple offices and multiple businesses operating in the same building. So what happens in those shared spaces? Who makes sure that the elevator is clean? Who makes sure that the stairwell is clean and secure? So other things, again, about language and consistency is words like may or should or to the extent possible that you'll see in the guidance. So, you know, using language like this does not necessarily require that employers adhere to the guidance, and it doesn't fully explicate the flexibility in implementing some of this guidance. So without that clarity, it makes it hard for workers to say this guidance isn't being followed when it's really just guidance that should be followed. It isn't required to be followed. Another thing that we have been seeing a lot with COVID-19 is this terminology about masks, respirators, and face coverings being used interchangeably. And so when you go through the guidance, you'll see that these words are thrown around without much explanation about the differences between each of them. So the guidance would ideally, you know, provide more information about the differences in PPE that is being provided to workers. And again, related to, you know, the sectors, and, you know, we looked at the definitions for essential businesses, and when we looked at, I think it was the farming, food, beverage, and cannabis production and agriculture. When you look at it at a granular level, there's so many different sectors and organizations, and a significant amount of diversity in each of those sectors. So each business is not run uniformly. And so, it's something to consider. Do these checklists or kind of canned guidance for large sectors, are they really sufficient in providing guidance for employers to protect their workers? Another two more important things that I will add. One is that there's no real mechanism to confirm in the state that employers or their employees understand the guidance or feel like they can implement it. There are some state agencies that obviously will assist if you need help. Illinois OSHA is an example of that, and their consultation program. But for the most part, there's nothing outlined in the guidance to ensure that people understand what they need to do in their businesses to keep both workers and consumers safe. Another important thing is employer and worker education is also, not really called out throughout the guidance. And so that's something, again, very important to confirm that there's understanding and an ability to implement the guidance. And so, really, we wanted to walk through this guidance and to give you an opportunity to think about who's impacted in these businesses, how employers would respond, and what the implications are of this guidance that is being put out by the state. Is it sufficient to protect workers? What is missing? And really, asking you all, when you look at similar guidance, to look at it with a critical eye. There is a tremendous amount that is being put out by both state, federal, city institutions, private and public. And there is some concern that employers don't know where to look necessarily, which is why we wanted to look specifically at this official state of Illinois reopening guidance. But put yourself potentially in the shoes of an employer and a worker. Is this guidance sufficient? Would you understand it? Would you have the resources to implement it? If you were a worker, how could you ensure that your employer is following this guidance? What would you do if they weren't? So these are all questions to think about when you're looking at some of the guidance for the state. And like I said, I'll include a link in the chat box so you have it. And when we post these slides on Blackboard, we'll also include a link. But yeah, I think that might be our last slide, actually, if we want to jump into questions or discussion. Again, we represent the UIC Center for Healthy Work. We are a center of excellence for total worker health funded by NIOSH. I did include a link to our website in the chat if you want to get in contact with either of us. We do work outside of COVID-19 response, but that has definitely dominated a lot of our activities over the last few months.
Excellent. Thank you both very much, Professor Conroy and Elizabeth Fisher. This is very informative information as you share with our class tonight around essential workers and a breakdown of everything. At this time, we would like to allow you to submit your questions via the chat, or if you want to speak any of your questions, feel free to do so at this time. We kindly ask you to engage them because this is very valuable. Everyone right now is telling you thank you for your great presentation. I'm sure you may see that. Are there any questions they really would like to answer them for you?
Hi, Liz and Dr. Conroy. I was going to type my question, but it might have taken too long, so I'll just ask. Yeah, related to what you were just talking about, Liz, with the reopening guidance, would an employee have a right to file a complaint through OSHA or Illinois OSHA if their employer, if they didn't feel like they were protected enough?
Yes, they do have the right to file a complaint.
Okay.
Federal OSHA has not, actually they're getting thousands of complaints a week at federal OSHA, and they've also taken a somewhat hands-off approach, although they have now recently started some inspections specifically in food processing facilities. but that was a big topic of discussion when we were talking about these guidance, like who is enforcing these guidelines? Because OSHA isn't going to enforce this guidance. They're going to look to see, has the employer done, are they, there's a general duty to protect workers. Like there isn't a COVID standard that OSHA could enforce, but there is a general duty to protect workers. But they're not going to enforce the specifics of a state regulation or a state set of guidance. But during this piece, that was the same question that the local health departments were asking. And under the communicable disease law in Illinois, the local health departments do have the ability to inspect workplaces, not specifically for worker protection, but for preventing communicable disease. And the state's attorney general stepped up and said that they were going to be the backstop for these local health departments to do this kind of inspection work. If you're a public sector worker, you could file a complaint with the Illinois OSHA.
And I think so if a local health department if you did not go to a local health department with a complaint, you could go directly to the AG's office. I think they are taking complaints directly. And, in Chicago, the Bureau of Consumer Affairs and Protection, I think is also, I'm not sure their response to complaints, but they have, I think, I saw something today that they are being a bit loose in their response, but they are taking some complaints from workers and the public.
Got it. Thank you.
Hi, I also have kind of a long question that I'm trying to type while you're talking, and it just turned out to be too long. So I'm actually running into a bit of an opposite problem. I've seen patients that are persistently testing positive despite it being weak from their index illness and no longer having symptoms, really seem to pose for the CDC guidelines no significant known threat that they know, but aren't being allowed to go back to work because they continue to test positive. So I don't even really quite know what my question is, other than is there protections for those people? Because I on the one hand understand the stance of the business not wanting to take that liability, but these people aren't able to work, often are breadwinners for their family, and so it's just become a very difficult situation. Thank you both.
Yeah. Yeah, I think that's a complicated issue, right? So you're right. Many employers don't want to take on the liability, so they want to have a negative test before they allow someone to come back to work. Maybe even including the University of Illinois outside of the hospital. The hospital at UIC has taken the CDC, where if you're a certain number of days without symptoms and without fever and other things after your first test, and I don't remember exactly, Linda may know, but it's 10 days or 12 days or 14 days, I don't remember. Then the thought is that you can go back to work. But that's a risk too, because we don't really have any science on that either way, whether those people are okay to be around or not okay to be around. I don't think we really know the answer to that. And then there are other workplaces that it's the opposite, where you're being told if you don't come to work, you won't have a job. And the meat processing plants in particular have like attendance bonuses. So if you have good attendance for the whole month, you get a couple of, $100 extra or a couple of $100 extra. And if you're a really low wage worker, that's a big incentive to go to work. And so that, we've had sort of both sides of it, where workers have been probably told to stay away longer than they need to with the income, with the hardship that goes along with not working. Part of the challenge we have in the US is that we don't have a paid sick leave program. There, local jurisdictions have paid sick leave, but across the board there isn't a lot of paid sick leave. So outside of some jurisdictions like Cook County or some states like Washington State, I think paid sick leave is also not something that you're guaranteed just because you have a job. So there's also additional sort of incentives or disincentives to get tested and to stay away from work.
Thank you.
And I don't know who would enforce the return to work. I think if you're being told to come to work, there are enforcement mechanisms under the, that you could complain if you felt like you shouldn't be going to work.
Excellent. Thank you very much. We do have a couple of questions. Do you know if the public health departments are working with OSA HI?
So,
Liz?
I do know that Illinois OSHA is in collaboration with the Illinois Department of Public Health and with the Illinois Department of Labor. I am not sure if the local health departments at the county level have a direct relationship with Illinois OSHA. That's not to say that they don't. I'm just not familiar with that.
Okay, excellent. Thank you very much. And so who's responsible for paying for the testing when people have to go in for those tests?
I think that's also not entirely clear, so if I want to get tested on campus, the UIC program, I guess UIC is paying for all of that testing. I can go and, drool into a cup and get my test. That is being paid for, I think, by the university. I think some of these drive-up testing places were supposed to be, there were a number of them where you were supposed to be able to get tested for free. We were trying to encourage people that might need to know that they're positive to get tested. But there was some confusion about that too. We've been on a number of phone calls, Liz and I both, where, they ask for insurance information when you go to the drive-up testing. And then they don't explain that you can get the test for either whether you have insurance or not. But if you have insurance, they're going to charge your insurance company. If you don't, then the state will pay for it, But they didn't make that clear. So people were deterred from going because they don't have insurance. And, there was a sort of lot of confusion about that. I think if your employer is requiring you to do something as part of their meeting workplace standards, they are required to pay for that. So if they say, in order to work, actually on our campus, in order to live in the dormitory, you have to get tested every week. Well, the students that live in the dorm don't have to pay for that. The university is imposing that rule and they are paying for it. I think that this sort of idea of being negative tested to return to work does push the burden onto the worker, and that poses more problems, both from a cost burden on the worker, but also as a disincentive to getting tested, and therefore maybe continuing to spread the disease.
Thank you. Yeah, another question, is there an issue with confidentiality when employers are informing workers about a coworker that is infected or positive?
There is confidentiality about that. They can't disclose who has it, and in many cases they're just not disclosing at all. They're asking workers to stay away, but they're not telling the other workers. Linda would probably know more because she's been working more on the occupational medicine side of things, or we have physicians in our practice that have been providing that kind of guidance, like how do you communicate about risks in the workplace while also protecting confidentiality. I don't think it's an easy thing to do. And there are sort of competing interests on that. There's interests for privacy, which are legally enforceable, and then there are interests for protecting other workers that may also be legally enforceable. It's not necessarily an easy thing to sort out. They're separate pieces of legislation.
Thank you. We have another comment question. This might be outside the scope of the discussion, but what are your opinions on public schools remaining closed for the most part, especially consider drug abuse, overdose seems to be on a rise, and suicides are rising among the young, particularly young girls and women? And does this risk outweigh the benefits of protecting teachers at the expense of students' education on mental health? I can repeat anything.
Yeah. I was trying to sort of balance some of that in that there are risks to not working, there are risks to sheltering at home, there are risks to putting a lot of people into a common space that's in most public schools at least would not be a safe environment for the students or the teachers or their parents or their grandparents or, you know, the whole group of people. So, you know, my approach would be that this shouldn't be a dichotomy. Either we, you know, live with suicides or we live with COVID. I think that there are other public health things that could be done. We just seem unwilling to have those discussions. Like, how do we, you know, massively expand mental health services and also, you know, maintain social distancing and possibly schools still being closed in order to protect people from COVID. But we never seem to have that sort of like, what else could we do? It's always, you know, presented in many cases, not always, but in many cases it's presented, you know, there's these risks or there's these risks and which are more important, as opposed to like trying to come up with a more comprehensive solution. I do think that, you know, having much more broader mental health services in general, you know, could persist even after this. I mean, it could be a benefit coming out of this if we could gear up for that. And then even when we went back to work, we would have, you know, a better infrastructure for that. But that's, I don't know, Liz.
Yeah, I would also add that it's you know, something to think about is that school closures are not just about protecting teachers. You know, it includes protecting students and potentially bringing home an infection to their families who might be essential workers. It's also about the other people who work at the school, like administrators, you know, janitors or grounds people. So just important to note that when we think about schools, you know, while teachers might be taking on a higher level of risk, that the students also being there presents risk for their families and their communities and also the other staff and administrators at the school. Oh, and I see someone also just made that comment in the chat. Thanks.
Yes, they say it's also important to note that it would not just be the teachers and auxiliary staff at schools, but it would represent an important reservoir for widespread transmission, which we've been seeing. Another question we have is, does the higher percentage of people of color who make up the essential workers play a large role in why these communities are showing higher rates of COVID-19?
I think that is the case, and I meant to say that explicitly, that while we're thinking about these racial inequities that we're seeing in terms of both the disease rate and the death rates, and a focus on underlying health conditions, which I'm not going to say aren't important, I think they are, but I think there's an occupational piece in this that we've been sort of either, you know, it's remained invisible throughout this, and even just trying to get data on how people are exposed or how many people through the contact tracing are actually getting sick at work, it has been extremely difficult. So these are all sort of proxies where we look at, you know, these are essential workers that have possibly some risk, and then this is what that workforce looks like, but it's impossible to connect someone that got a disease to an exposure at work through our current systems. But I was hoping that by the end of this, people would take away the idea that, you know, this isn't just underlying conditions or crowded housing, that work probably has a key role in why African Americans and Hispanics are bearing a higher proportion of the disease.
It's true. Thank you. Another question is, do you think that the essential workers who do not follow the masking guidelines should be penalized?
I mean, I don't like to penalize anyone, but, you know, in a workplace outside of COVID, if a worker is supposed to wear a hard hat on a work site and they don't, they lose their job. You know, that the employer has some responsibility to ensuring the safety of the workplace, protecting their other workers in the facility, and also their business enterprise. So I do think there are mechanisms in place. I haven't seen a lot of employees, at least I don't go anywhere. I really am one of these people that really has embraced the staying at home. So I go to the grocery store like every other week and that's it. But so I can't really speak how widespread non-mask wearing is among employees while they're at work. So I don't know how big a problem it is, but I do think there are mechanisms where workers that don't follow the rules set out by their employer, the employer can take action about that. Now, whether the employer wants to do that or not, I don't know. It's, you know, in many cases, we've heard the opposite from our worker centers, that they're being discouraged from wearing masks at work or from protecting themselves. In fact, I was in a lecture with the former head of OSHA right before this, and he was talking about a contracted worker who went to work in a hospital with her own N95 and was told to take it off because other workers doing that same job were not given respiratory protection. And if she was wearing one, everybody else would. And then she lost her job. And because she was contracted, she didn't have any protection against being fired. So I think, you know, my experience has been that when workers are told by their supervisor to do something at work, they do it because they can lose their job if they don't. So in some case, you know, so a lot of non-compliance on the part of workers is often a management issue and not a worker issue. Just, you know, again, outside of COVID, but just in practice, when people, you know, I work with someone who had this very funny response when we were in a workplace once, and somebody was saying, oh, we tell them they should wear hearing protection. They just don't. And it's, you know, there's nothing we can do. And my colleague said, well, what if they came to work and refused to wear their pants? And then the, you know, the supervisor was like, well, they wouldn't work here. And he's like, well, that's the answer. You know, you set an expectation and workers do that. So I think there are, you know, often it is a supervisor or management issue as much as a worker issue.
And just to tack on to that, you know, when we talked about the guidance that the state of Illinois put out, you know, pay really close attention to the language if you do take a chance to go through that, because, you know, much of the language is intentionally not, you know, required because it's not enforceable at the moment. And so you'll see some comments like people should be wearing masks. Should could be interpreted as I don't need to. I should do it, but I don't need to. And so, you know, to reiterate this fact that, you know, it might be at the leadership level, or it is likely at the leadership level, if they are not enforcing guidance or telling their workers that they should comply with this guidance, then, you know, where's the incentive to comply, you know? So it's really important to take a look at that guidance with a critical eye.
Okay, thank you. So another question, do you think social media can or does play a role in holding businesses more accountable for having protective measures in place? And someone said, yeah, would be an example, but this may be more helpful for the consumer than the employee, however. So social media's role.
You know, I think that, actually, this is also an example from the lecture I was at earlier, you know, that airlines have been, you know, really hard hit. Nobody wants to fly because they think they're going to be at risk, and I get that. And at the same time, there are people that, you know, are refusing to wear a mask, not employees. The employees want everyone to wear a mask because they want people to fly and they want to keep their job, you know, so they're complying. They want everybody that gets on their plane to comply. So I think there are some opportunities for wider spread social media. It's just social media is so complicated right now. I don't know whether complicated is right. You know, there's so much misinformation now on social media too that it's hard to sort out how that might be useful. But again, if I was going to go to a restaurant, I might want to know, as you suggest, as a customer, you know, are they, you know, practicing the good recommendations? Are they, I'm not going to a restaurant, but if I was, they might, yeah, I might want to know that. Like, are they, cleaning? Are they keeping people apart? Are their workers staying as far apart as they can? Are they, have they put in place other measures? And so I don't know. We've talked about this social media as outside of COVID, but as a way to pressure employers that engage in high levels of precarious employment as a way to get them to change their behavior. Where, in better times when unemployment was low, sort of just having sort of messaging from workers saying this is a good place to work or this isn't a good place to work, that might then result in more better conditions for workers.
And again, I'll just tack on to that because it's a great question, and it's so funny because literally minutes before joining this class, I was on one of my social media pages. I was on Instagram, and a local business that I follow that is doing delivery only right now. They don't allow customers into their storefront. Posted a number of Instagrams in their kitchen, and no one.
We lost your.
Can you hear me?
Yes.
Okay, great. Sorry, I don't know where you lost me, but I had a local business that I follow on Instagram that their kitchen is open, but their storefront is not. Posted a number of pictures in their kitchen with no one wearing masks. Some had them around their necks, but for the most part, no one was wearing masks. And this is a business that I ordered from last week. And so I sent them a message and I said, no masks, ? And they responded. I got a very long response justifying all the reasons why they felt like they did not need to wear masks. And it was partially because they were not open to the public and they were only offering delivery. And I didn't get a chance to pursue it further because I joined this class. But, it is funny because I do think social media is potentially a place, not only in things like Yelp or Glassdoor to say my employer wasn't compliant or as a consumer I didn't feel comfortable here, but I saw really quickly that there were people at work not wearing masks, and I'm looking for that because of the nature of my work. But I think social media can be a very powerful tool in that way, and you better believe I will be keeping an eye on this business going forward and will be responding after class.
Thank you. Thank you so much both for that. That's important. Another question is following the SEIU and the INA strike, what areas do you believe that UIC needs to improve for better occupational health for their faculty?
We followed that, and we were very supportive of aspects of the strike from our center in terms of safer safer staffing, lower staffing ratios. There's some evidence that's come out of California and Washington State that have set limits on, healthcare provider to patient ratios have resulted in improved occupational health. So we were supportive of that part of what the INA was asking for. And then, from the beginning, I've been very frustrated by the rationing and the reuse and the fact that we've been so slow to ramp up available PPE. I think we could have done so much more. I think the manufacturers could have been forced to do more, but there's no real reason for the manufacturers to produce more than they think they can sell. So unless the federal government early on said we're going to buy whatever you can produce, there was no reason for them to do that. So I think I've been super frustrated with that. I think that's gotten better as fewer patients have been in the hospital, but things may get worse again as we move into the winter. There is this sort of things died down over the summer, not as much as everybody thought they would, but it's not like it was in March, but it might be in November, might look like March again. I don't know. I think in other cases, in terms of the way I've described things, UIC does pay better than the minimum wage and has, unions, so people are able to collectively bargain. They have a voice in their workplace. So I think there's, quite a few things that make UIC a good place to work. And the hospitals are dangerous places to start with. So actions, activities that include, or collective bargaining that includes improved workplace conditions, worker health and safety, I'm usually very supportive of. But I don't know the details of the contract yet, because I think it isn't, they reached an agreement, but their membership still has to settle, and I haven't looked to see what it actually includes. Well, I haven't looked. I don't think it's public yet. I think they're still in the voting range. They've shared it with the members, but I don't think it's been released as a signed contract yet.
Okay, thank you. Thank you very much. We have said the term guidance alone means that it is a suggestion, right?
Yes. So generally, we have regulations or standards that are legally enforceable, and then we generally have things that are called guidance or best practice kinds of documents that are generally not enforceable, or at least directly enforceable. So I said before that OSHA has a responsibility to ensure that employers under the OSHA Act have a responsibility to provide a safe and healthful workplace free from recognized hazard. Sometimes the guidance documents, not so much under COVID, but in other cases, guidance documents can be used as justification that it was a recognized hazard and the employer should have known to do something different. It's a harder, higher bar to reach from an enforcement point of view, because you have to sort of show that it was a recognized hazard and they also didn't protect from that hazard, whereas for things that have specific standards, they just have to show that they didn't meet the standard. But, so guidance sometimes can be indirectly enforceable, but in general, the term guidance means that it's a suggestion. And it came out of the Department of Commerce and Economic Opportunity, which doesn't really have any enforcement authority. The Health Department has authority and the Illinois OSHA has authority. The Commerce and Community or Economic Opportunity doesn't have any real enforcement authority.
Okay, excellent, thank you. And one last comment was that Glassdoor has actually been helpful in that respect, in my opinion, from a conversation we were talking about a little bit earlier about businesses and so forth. So those are the last of the comments that were posted. I just would like to say thank you again, along with our class, for this excellent presentation that you all have shared with us as it relates to essential workers and the great work that you all are doing. So thank you so much. I will turn it over to see if Dr. Frost has anything she wants to add.
Hi, thank you so much for a great presentation. It's funny that we've worked together, Dr. Conroy and I have worked together for many, many years, and Liz and that whole team on the Center for Healthy Work are working on the same issues, but I always learn new things when I hear from you guys, and I'm so impressed with this work. And I have to say, Liz, you're a pretty quick study. Relative to how many years, I've been in this. So
Thank you.
Okay, we'll wrap it up. Good night, you guys. Thanks
Right,
again.
thank you.
Good night. Thank you.
Thank